Good afternoon, everyone. It's Fabio Lima again here at the CVIS conference, and I'm here with Dr. Poonam Velagapudi, an old friend of mine. We knew each other back at Brown, and she then trained at Columbia afterwards, doing her structural training. We're here at CVIS, and Poonam just got out of a great discussion on lithotripsy and rotational atherectomy. We really all learned a lot. It was a great talk. So Poonam, please tell me more about this new data that's coming through with lithotripsy and its use in women, showing some additional benefit than we've known in the past.
To talk about atherectomy versus lithotripsy in 2024. I think the atherectomy topic is a well-beaten topic. We all know a lot about the rotational atherectomy and orbital atherectomy and the uses for it, but the lithotripsy balloon is fairly new and probably in the last year or two, and it's a device that we can use for calcium modification, particularly without as many complications or fewer complications or even close to zero complications, particularly in women. And I say that because there's been an analysis from the Disrupt CAD trials, a pooled analysis of all these patients, and they looked at the differences between men and women. So there was no difference between men and women in the outcomes. Whereas in the past we've seen with rotational atherectomy, women have worse outcomes just because they have smaller vessels and more calcium. So the new SKY guidelines or manuscript about the PCI in revascularization kind of suggests that maybe lithotripsy will become the choice of calcium modification, particularly in women. And so that's what I highlighted in my talk.
Yeah, that's fascinating. And I mean, do you think it is because historically, traditionally, there's been more of a cautious approach in the size of the burrs that physicians have used in female patients, and thus they're not getting the most bang for their buck. But whereas with lithotripsy, we feel very safe and comfortable using it in a one-to-one fashion. Do you think this is why we're seeing an incremental benefit of lithotripsy?
Yeah, so I think the most important thing, like as I mentioned at the beginning of our discussion, is that women have smaller vessels and more calcium. And so when you really want to modify it, the lithotripsy balloon goes from 2.5 to 4. So you can use it in both smaller vessels as well as larger vessels. But the only caveat is obviously that it has to be a balloon crossable lesion. And so it is, as long as you keep within the limits of going up to 4 atmospheres and delivering the number of pulses that you need, I think it's pretty safe. And that's what we've seen in the outcomes from all the Disrupt CAD trials. Whereas for rotational atherectomy, we have seen worse outcomes in women in previous analysis.
Yeah, I think what's also really exciting in this whole area is the use of OCT and IVUS, and particularly with OCT, you can see those deep cracks that lithotripsy can get you. And sometimes we go into these cases with a mindset, oh, we're just going to ROTA or we're just going to IVL up front. Maybe we need a combo of both, but I've just personally encountered these scenarios where we